So another staggering statistic that is the reason we're sitting here talking about this today is in 2014 there were 52 deaths per day related to overprescription of opioids. I'm Dr. Jessica Imes, physical therapist. I currently work for Tri Health, where I oversee corporate health rehab services, including massage and physical therapy.
My name is Rob Dunham, and I'm a physical therapist. My job title is the Family Wellness Center Manager. I oversee a multidisciplinary facility that includes primary care, physical therapy, occupational medicine, pharmacy, a fitness center. We have multiple different specialties here.
So I'm definitely concerned about the growing epidemic, and there's been a lot of discussion, of course, in the news lately about this, and I think it needs addressed.
A couple things. One is I have a family member who's gone down this path, and I feel very passionately about trying to keep people off of prescription medications if possible. And then I see it all the time here at our Family Wellness Center. People start down a path of pain, they get into opioids, they get prescribed, and they continue to get prescribed because people don't know what to do, and by the time you get them in physical therapy, they are down a path that you don't really want them to be.
In my experience, there have been a number of patient types that I've seen in the category of opioid addiction. A lot of times it's people who didn't get to the right provider first. And I think that we need to do a better job of identifying those people, screening that out before going straight to that prescription.
What I've seen in my experience is that patients or people, they continue to be prescribed by their physician, so they feel like it's okay. They're not being told the warning signs, they're not being educated on the possible consequences of long-term opioid use.
As a physical therapist, the way that I've tried to combat some of this is to reach out to primary care physicians and work together to educate them on the different types of patients that may benefit from trying physical therapy first.
Number one is education. I think the biggest thing we can do is education. It's educating our patients, it's educating our family, our friends, physicians, letting everyone know what physical therapists and physical therapy can do for patients who may otherwise be on opioids. But number two, once we get those patients in our clinic, is letting them know the dangers of long-term use.
In the past, the way I've worked with patients when I suspect that there is an addiction is to contact the primary care physician and talk to them about my concerns and look to see if we can work together to wean them off. One of the things that I've found helpful is the use of a TENS unit. That can help to reduce the dose that they require because it can help manage some of the pain.
So reaching out to the resources that are available in the community for our patients. Like I said, many employers do have an employee assistance program, so understanding what that is and helping those folks reach out to those people. And then just being knowledgeable in the community what resources are out there.
So I've had some instances of patients who seemed likely to go down that addiction road. Usually it's post-surgically because that's often when it gets prescribed. When that becomes a concern just based on the personality and knowing the potential there, I've called the physician and worked with them on how we can get past that by using a TENS unit, using electric stimulation, maybe even using massage and different techniques to help them manage that pain and understand. So I do see that there's a problem with overprescribing pain medication, opioid-based painkillers, and I know that it's not any one physician or any one group. It's kind of on a whole. But I do think with everything in the news, there is an awareness. I know the physicians I work with are very aware of it. They're required to check a national list to see what type patients have been prescribed in the past, and that will dictate whether they can prescribe it again with that patient. So I know that they're taking a lot of steps.
I think it's getting better, but to answer your question, to answer the question of whether there is a problem with medicine as a whole overprescribing, I think it's still out there. I mean, we've seen patients who are getting upwards of 600 name your pill a month, and it really is a problem. So when we talk to those folks, they want to continue that prescription.
In physical therapy, the way that we can help prevent the opioid overuse or abuse is to educate the patient. I think that's probably the most important thing we do as physical therapists. Educate the patient on the cause of their pain, the nature of their pain, the expectations and outcomes that we have for physical therapy, and talk to them about these very real issues.
To be able to combat this opioid problem we have, I think the first is education. If we can, as a profession, as physical therapists, if we can get out there and we can educate the public, the community, our physicians, the specialties that refer in to us, the specialties that we work with, that's the first thing we need to do, is let them know how physical therapy can help and potentially prevent this problem from getting worse. Secondly, is helping manage those folks that have an opioid problem, helping them to understand what they can do for themselves, how they can self-manage, and how we as physical therapists can be a resource for them. It's not just a treatment. We can be your physical therapist to help you manage this throughout your life so you don't turn back to